Hello everybody. You're welcome to my channel. I'm Dr. Sanaj, I'm practitioner. We are on live streaming for some that topic which is most wanted from the parents. Yes, parents want it's kind of not only the advice from a doctor, but it's also advice and experiences which I really gained during my parenting journey. So this topic is most wanted. Most of the parents request me for this topic. This topic is picky eaters. If you are worried that your kids not eating food, your toddlers not eating food, or eat only one food and not eat multiple food, and very sticky to one food, and even he's running on in front of you and saying I am not interested in food, then this live streaming is just for you, because I'm going to discuss why it happens, are the main reasons behind that kids are not interested in food. So I will give you some solutions which really work for you. So stay with me. I'm Dr. Sana, general practitioner. You are welcome to my channel. Stay tuned with me. If you have any question and inquiries, you can ask me. I'm always available to answer you. Being doctor and being mother, it's my duty to guide you. And that today our topic is picky eaters. Picky eaters are those kids which don't like to eat food by self and don't even want that their parents feed them, and they only stick to one food, or might be they don't like multiple food. So these all are included in picky eaters. Here, one parent join us, and she is saying most wanted topic. Yeah, this is really most wanted topic. Most of us mummies are really sometimes fed up and feed all the time, running behind our kids, and it's really frustrating and very tired situation. And on the other side, we are really worried about the health of our kids, because our kids are not taking multiple nutrient food. So every mother, every parent want their kids must eat all things that contains a nice multiple nutrients which are really important for the health purpose. So it's everybody problems nowadays. So we are talking about the picky eaters. Hello, parents. Welcome to today's live session. I'm Dr. Sana, general practitioner. You are welcome to my channel. If you are here, I already know your problem. Your child eats very little, eats only selected food, refuses vegetables, fruits, or home food, eats well one day and nothing the next, makes you anxious, angry, and helpless. Let me tell you something important first. Picky eating is one of the most common problem in toddlers. It does not mean you are a bad parent, and in some cases it is temporary and fixable. Today I will explain what picky eating really is, why toddlers become picky eaters, what is normal and what is not, how much food a toddler truly need, what mistakes parents make, what actually work, doctors approve, and I will answer your questions live. Please type in the chat your child age and biggest eating problem. What is picky eating? First of all, you should understand what is picky eater. Picky eating means a child eat a limited variety of food, refuses new food. He is strong. He has strong like and dislike issues. Eats inconsistently. Let me be very clear. Picky eating is a behavior, not a disease. Most picky eaters are healthy, are growing normally, just want control and independence. Why does picky eating start? Usually between 1 to 3 years of age because growth slows down, appetite naturally decreases, child want independence, taste sensitivity increases. Important thing to understand, less eating does not always mean poor health. So, if your child is eating less, it doesn't mean that your child is unhealthy or he has poor health issues. No. Unless your kid is active, eating less but eating good nutrient food and eating very active, smart, no need to worry. Common Here are some common questions which parents mostly ask to doctors, and in generally we have answers most of the time in different platforms regarding these questions. But today on my live streaming, I'm also answering you all. But you are first of all, you all are welcome to my channel, and you can ask me any question if you feel, and kindly join me and you will get your answers because our kids are, everyone kids have some issues, but most of the parents, the most likely they talk about their toddlers, the issue is picky eaters. So most common questions which I heard during my practical routine, that doctor, my child eats very little. Is this normal? So my answer to them is yes, very normal. Toddlers need much less food than babies. Parents often compare with adult, which is wrong. Normal piggy eating versus dangerous size. So You all are welcome to my channel, and if you join me, just I wanted to tell you that doctor most of the time parents ask me questions. Doctor, why my child will eat very little? Is it this normal? My answer to all those parents, if they have this question in their mind, it's very normal. Toddlers need much less food than the babies. Parents often compare with adult, which is wrong. Normally, picky eating versus normal piggy eating versus dangerous science. Yeah, this is the most important. You should understand that if your child is picky eater but it has normal health, and the versus that child who have dangerous signs, you should understand this concept, then you will no worry. Okay, normal picky eating, your child is okay if active and playful, normal height and weight curve, eats at least 1 to 2 food from each group, drink milk, no vomiting or choking. Even if food variety is small, growth matters more. Red flags, you should understand some red flags. These need medical evaluation. Poor weight gain and weight loss. Eats only liquids. Gag or choking often. Developmental delay. Constant vomiting. Important sentence. If your growth is normal, if your child growth is normal, picky eating is usually not dangerous. Common parent questions. I'm answering you all the common questions which parents ask. So I answer you the first question. Now the other question which parents ask me, doctor, my child eat only milk. Is this okay? Most of the parents complain such questions that their kids only drink milk, they love to drink milk, they often like to milk. Whenever they feel hungry, kids and the kids ask for milk and they cry for milk. Yes, some parents are suffering with this situation. So most of the questions I heard, doctor, my child eat only milk. Is this okay? My answer to them is no, not okay long term. Milk fills the stomach, reduces hunger, causes iron deficiency. Safe milk limit should be maximum 500 ml per day. So keep in your mind your child should not drink more than 500 ml a day. How much should a toddler eat? This is most common question which I heard. Parents don't understand what the normal diet plan should be and how much the toddler should eat. This is very, common question. This is where parents panic the most even. Toddler stomach size very small, about the size of the child fist. Daily expectation should be 3 meals, 2 snacks. Some days eat well and some days eat very little. This all is normal. Okay. So appetite change daily in toddlers. I have seen so many parents that they don't schedulize their child meals. So always remember you have to schedulize. You have to fix the timing, which time the kids will eat what. If they have timing for the food, like they have lunch time, breakfast time, dinner time, it should be like fixed. And the snack time you have to fix between the breakfast and the lunch. One meal, one snack time, and one snack time should be between the lunch and dinner. Yeah, it's been two snack times. These all timings should be scheduled more appropriate, more understandable. Then your child will start noticing their brain that they will get the food at this time, and gradually you will see your child will take mm, 3 meals and 2 snacks every day, and you will be very comfortable with this. You can add in these meals multiple things with your choice, multi nutrient foods. You have to see what group they are eating in the breakfast, which one they should eat in the lunch, what should be in snacks, and all that. Even I have updated so many videos which even shows the 1 day meal plans. So 1 day meal plans are also available on my uh, channel. So you should subscribe my channel and watch the videos over there. You will found there are even the meal plans ideas. You will take them and use them. And so I am talking about the meal should be 3 meal and 2 snacks, and it choose healthy and wisely, and as per your kid choice as well. Make it habit slowly and gradually. Your kid will adopt. Eating less, sometimes eating sometime more. It's always sometime happened. The next question is about picky eater. The third question, which I often see during my practical life as a mother and as a doctor, but I will answer this question and I will talk about this question after a few minutes. So stay tuned, everybody. Join me, and if you are new here, then I am going to tell you we're talking about the pig eaters. And what is pig eater? Pig eaters are those kids who are not like to eat the food by themselves. They don't like to eat any food. They don't like even different groups of food. They only stick to one food, and sometimes most of the time they don't like food. So we are talking about those kids, those toddlers. So everybody stay tuned, join me, and if you are new parent, you are welcome to my channel, and subscribe my channel before going to any deep dive into another topic or any topic. And the other thing which I want to ask tell you that please share this all videos to the other parents, because they also deserve and they also need the guidance. And I truly understand being mother, sometimes we mummies don't have much time to talk small things with the doctors, and we go to the clinics and hospital, but we really want doctor based advices. So this channel is for those kids, for those parents who are thinking that they have not much time, but they really have some questions in their mind regarding their child health. So you all are welcome here. You can ask freely any questions. I am here to answer you. Well, I'm giving you some questions answers regarding the picky eaters. And the other question which I heard most of the time from parents, that is, doctor, my child eat only milk, is this okay? Then my answer to those all parents, please no, only milk is not enough for any toddler or child. They need proper diet every day. Okay, milk only fill the stomach, reduce hunger. It may cause the iron deficiency. S- Safe limit of the milk is important, but it should be safe. It should be like 500 ml maximum per day is enough. More than that, your child can't take, because if your child will take, his stomach will always be full and His hunger will reduce and he will not get other nutrients in his diet, and he will be not it will not be a balanced food. So how much should our toddler eat? This is also very common question. How much a toddler should eat? This is really very common question, because most of parents give few, and because it's always vary upon your child. Some child, in even in your family, if you have two child, they both are very different from each other. One child eat different food types, and quantity and quality both are different, and the other child is eating also different, like they have other types of food, other quantity and quality different from the his elder kids. So always you have to scheduleize, you have to, what you have to do is you should make 3 meals and 2 snacks every day. These 3 meals contains healthy multi-nutrients options. You choose wisely, and according to your child choice also as well, but you have to choose which contains, which are rich in nutrients. So I have some meal plan options in my channel already. I have updated the videos where you can see the meal plans, free 1 day meal plans. You can get those meal plans, and you follow those, you will get very good results. But for your here answer is, you have to scheduleize your child meal. It should be 3 times meal and 2 snacks, and always make sure that timing should be appropriate. Make the fixed routine of your child. If you're making the routine, now it's a breakfast time, your child will eat the breakfast, choose the good nutrients, give egg, milk, according to your choice, but definitely you choose the good diet, multi-nutrient diet. And then you have to choose lunch, and lunch you have to choose what nutrient else. And then in the dinner, and between the breakfast and lunch, you should choose one snack, healthy snack. Between lunch and dinner, you should choose another snack which should be also healthy. So make routine, make timing, appropriate timing schedule, then your child brain start accepting this. So slowly and gradually the changes will come. Your picky eater will start tasting things and touching things, and slowly and gradually into the food, and he start loving food, and he will be no more picky eaters. So some days they eat well, and some days the kids eat not well. It's all normal, so don't worry. Just scheduleized, just make plans, make routine. It all work. Okay, and appetite changes daily in toddlers. This should be remembered by every parent. Appetite is not, sometimes your kid will be very hungry. Few days you will see your kid is not much hungry. This is very normal behavior with the kids. So don't be worried about that. Your kid is some days good, some days not good in appetite. This all is natural. The other most question I heard from parents is, my child eat well one day and nothing the next. Why? Yeah, this is what I was answering before even, that because toddlers regulate hunger naturally. Do not force food on low appetite days. Parenting mistakes that worsen pig eatings are, please listen carefully here, because I'm going to talk about some thing which is parenting do mistakes often. Number one, they force food. They give their child forcefully food. This will make them away from food. So you should not force your child to eat food. Forcing creates fear, power struggle, low term food refusal. So you will notice your child is more badly become a picky eater if you are doing forcing the food. Don't force the food. Number two, chasing with spoon teaches child. I don't need to sit and eat. You should give the spoon and encourage your child to eat food with on hand. First, he will eat less, then he will start eating more, and gradually, he will eat according to the hunger. But all mothers and parents, I'm advising you, in start you keep your mind and your um, focus on the children, that how much they eating. Always give the quantity. If they are not eating appropriately with the spoon, then you should help them, but encourage them that they should eat with their own hand. And the other mistake which parents do, they screens during the meal. Child eat without recognizing hunger or fullness. This is also useless. If your child is eating meal but not recognizing either he is hungry or full. The other mistake which I heard most of the common is cooking separate meal child learn. Never make separate food for your child. Always cook that food which you are eating. Because now this is a stage when your child will eat the family table food. After 1 year of age, your child will have to be able that he can join the family table. He can eat all the things from the table, not need to make the separate child food. So just keep in your mind the food should be less spicy and properly nice cooked, but not cooked separately. I will discourage this point. Always cook the same food which you like to eat, give your kids. Then your kid will be appropriately start eating with you. And never make lines such lines. If you eat your food, I will make your favorite food. I will um i will give you some treat or some chocolates or something like candies. Don't bribe your kid, just encourage them. So don't pressurize your child. Make him relax. Make him the food time enjoyable. Don't scold. Don't push. Don't force your child. Just relaxly give some food options on the table and encourage your child that he start eating with his home hand. If he can't, you help them, but encourage them. The other question which I heard is, Doctor, if I don't force my child, wouldn't eat it at all? Yeah, most of the mummies ask me this question that, Doctor, if I don't force my child, he will not eat. So, my answer is a healthy child will not starve themselves. Hunger is the best teaching. So, if your child will be hungry, he will definitely eat by self. So, no need to worry that your child will never eat. Your child will definitely eat. Yes, you have to be patient. If your child is hungry, he will eat with his own hand. No need to force him, and no need to give him food with your own hand all the time. And there is one doctor approved strategy that really work. Rule number one: fixed meal time. As I advised before, fixed meal time. No grazing, no food between meals. Rule number two: milk control. Limit milk. Offer food before milk. Rule number three, one family meal, same food for everyone. Rule number four, repeated exposure, offer new food 10 to 15 times. No pressure to eat. Okay, this is very important. Most of the parents are panic and they are saying why they are not eating the healthy fruits or vegetables. So they start putting and forcefully asking their kids to eat. Then in this way, your child will psychologically not like that food. He will start hating that food. Like he don't like that food. What you forcing? So don't force them, just make them options. Try to just first they will touch the food, then they will start smelling food, and then they will finally eating. First they will eat few bites and then later start eating properly. So in this gradual speed you will teach your child how they can eat. Because you have to just keep asking about the new food trial. You have to put them on the table and keep asking and even show them how you are eating. It's really safe food and good in taste. You have to make sure to your child in front of him. So encourage your child but not force them. So my opinion is, and it's a really psychologically very satisfying if you put the food and keep asking, but don't force them. Slowly and gradually, even after 15 time, if you are asking him 15 days, if you are making one food and asking him, slowly and gradually he start touching. Then he will smell. Then he will one day eat one bite or two bite. Next time they will eat all one bowl. So in this speed, in this way, the things work better and for the long term. But if you are forcing them, eat this, finish this, it will not work. It will make fear for the food. It will, the kid will start hating that food. So never force your kid for in this way. So be polite with your picky eaters. So my rule number five is division of responsibilities. Parent decide what and when, what to eat, when to eat. Child decide how much eat. So you should eh, give some responsibility to your child. Don't take all responsibilities, parents. I have seen so many parents who take all the responsibility. They think what their child eat. They always think when their child will eat, and they also decide how much their child will eat. In this way, your child will not eat much. Your child will vomit or he will fear of that food or whatever. So always you have to decide and you have to divide the responsibility. Being parent, you decide what your what time what your child will eat and when your child will eat. You have to scheduleize. Do you have to prepare the food? You have to give option of the food, but now give this responsibility. How much the child will eat the food, that will be decided by the child. So keep these five rules in your mind. Your child will definitely be fixed the problem. As I mentioned above, in a detailed about all these five rules, but again for summarizing all those new viewers who are just joining, we are talking about the picky eaters and we are discussing some strategies where we can fix the rules and the kids start eating in a better way. So for me, being doctor, being mother, practically, and as I experienced, I learned some rules which I am going to share with you. Rule number one: fixed meal time. You have to fix three meals time, two snacks time. You have to be mention time, like you have to breakfast in a breakfast time, then lunch, then dinner, then snack time between the breakfast and the lunch, and one snack time between the lunch and dinner. So you have to fix meal time, no grazing, no food between meals. And rule number two, milk control. Some kids are drinking too much milk, which limit their, mop their appetite. They don't like to eat. They only drink milk. They like to drink milk all the time. So you have to control the milk. Limit milk at least for not maximum. Maximum it should be 500 ml, not more than that. Okay, and offer food before milk, so that's very best strategy. Even as a mother, I learned this. If I give food first and then I give milk, that's properly nice thing. And the other is offer food before meal. Yeah, number three rules is one family meal. One family means that you cook one food or two food, whatever you make food, you put it on the table and ask your child to eat. It should be same food which you are eating, because at the age after age 1 year old, when your child will be 1 year old, your child should be able to join the family table. He should be able to eat all things which we can eat. So don't pressurize, just give exposure to the food, put it on the table and encourage. Definitely he will choose. Might be he's not choose on in a one day, but it takes time. It takes plenty of times in some cases. In some cases, quickly work, but it will work sooner or later. And the other thing, rule number five is division of responsibilities. Don't take parents all responsibility on your shoulder. Give some responsibility to your child as well. If you're you should be responsible what time your child will eat, what is time for the breakfast, what is time for the lunch, and what is time for the dinner. You should be responsible for this. When your child will eat, and what your child will eat. What he will eat means you give options of the food. You tell what should be in breakfast, what should be in lunch, what should be in dinner, what should be in healthy snacks. But give some decisions to your responsibility to your child, and that responsibility is how much he eat. It should be on child, that how much he eat. If he want a full plate or half plate or few, it should be totally on your child. Just encourage him, just motivate him, but don't give the bribes. Don't score, don't be aggressive. Don't be polite, and keep encouraging. That's what you can do. But always give decision power to your child, that how much he will eat. It should work. you know the eating thing should be enjoyable thing. It should not be fearful things. But in picky eaters, unfortunately, they sometimes start hating and fear of some food, that they feel that this food is not for them. That's why they stop eating that food. So my next question is, which I heard most of the parents, from most of the parents, and in the hospital and even in daily life routine, we heard such questions. So I made those list of questions and I'm answering you here. If you have any question, you ask me, feel free and ask me. The question is, my child refuses vegetables completely, what should I do? Yeah, this is very common questions. Most of the parents ask me that their child not eat vegetables and fruits. So my answer to you is, my advice to you all is, keep offering. Mix veggies in some other food. Eat veggies yourself. No force. Yeah, this is what you should do. If your child is not eating vegetables, number one thing, if your child is under one age or even at 1 year old, you give them all the vegetables. Try to give them, mash them and keep them or whatever. Encourage your children to give vegetables and fruits. But if your child is grown up, little toddler, but still he is not eating vegetable, no need to worry. Just keep offering. As this is the best strategy. Make food, put it on the table, and keep asking. Mix vegetables with some other food, like if they like chicken, you cook the vegetables with the chicken. If they like spaghettis or some noodles, you may put the vegetables in that one also. It will also work. And you can give some mixed options, then it will work definitely. Eat vegetables yourself. You are the role model for your kid. So when you all are sitting for the dining table for the dinner or food, you should eat vegetables and tell your kids that this is most delicious food, most nutrient-full food. Everyone should eat, and encourage your child. When you are the role model, when he will see you are eating and you are enjoying this food, they will adopt. Because our kids adopt every single things, every single habit of us. So we should be the role model. We should, if we are eating vegetables, our kids will definitely eat vegetables. So parents, if you are asking that your child is refusing vegetable completely, then these are the strategies which work. Number one, keep offering. Number two, mix veggies in some other food. And number three, eat veggies by yourself and don't force your child. This is the last. Okay, what food work best for picky eaters? There, I'm going to share you some food options which are really useful for picky eaters. If you try giving them these food, it improves their health. It improves their appetite, and they will start eating. So, what are these best food picky eaters do eat? Focus on nutrient dense food, not quantity. So, focus on dense food, not quantity. Best food: eggs, cheese, peanut butter, lentil, bananas, smoothies. Hidden nutrition ideas: vegetable paratha, pancakes with fruit, lentil soup, supplement, and appetite syrup. Yes, most of the parents ask me for the supplements and appetite syrups. Appetite syrups do not fix behavior. Syrup will not make routine. It will just, if your child is nutrient deficiency, then they will cover the deficiency that is, but it will not increase the appetite. Appetite syrup do not fix behavior. Behavior is that which we are role model and we are showing them, and they are adopting them slowly and gradually. And multivitamins only if advised. Otherwise, multivitamins are not need to give. Okay, if your doctor near you is advising you because due to blood test or some test, after test they found some appropriate deficiency, then they will advise you the multivitamins, then you can give. And otherwise, no need. Supplements cannot replace food habits. If you are giving the supplements, it will not replace food habits. If you are giving multivitamins, it's also not replacing the food, but it is should be advised by the doctor. Then you can give. Appetite syrup do not fix behavior. If you are giving them appetite syrup and you're thinking, yeah, their appetite will improve, but it will not fix the problem. The problem is your child don't like the vegetable, then he don't like it. If you're He will eat some else thing and fix the appetite. So appetite syrup will not fix the behavior. No medicine can replace good feeding practice. So in picky eaters, medicine not work. It is a practical behavior. So it need patience. It need moral. It need you are the role model, and you should practically show them how we can manage to eat. And it's all about the good feeding practice. Okay, we are live, so you can ask me question if you have in your mind regarding your child picky eater. So this is most wanted topic every parent want to listen about and understand and want a solution for the picky eaters. The other question is you can answer questions using these. Okay, the other questions which I heard, my child eat only junk. My answer is reduce junk availability. You don't provide them junk food. M- Make the habit of healthy food on your table. It work. And number two, I have heard the question is my toddler throws food. Ignore behavior, stay calm. Okay, this is will be the good reply, because if you will stay calm and ignore this behavior, definitely he will understand and he will stop throwing the food. He will eat and not throw. And if your toddler is small and he can't manage to eat with the spoon appropriately, then don't worry, it will work with the development of few hand muscles. It will start grabbing the spoon properly and then it work. But if your child behavior is eat small and eat throw less and walking and talking, mm, ignore these behaviors, stay calm. Should I worry about weight? Growth chart matters, not daily intake. So I will ask you, you should be worried about the weight if your child is growth is not in one day. Growth need a slow and chart. Make a chart. If it is working, it is properly growing, then it is okay. But if you feel there is some problem, you should consult doctor near you if the weight or the height is not growing. So parents, picky eating is a phase, not a failure. With patient consistency, calm parenting, most children improve naturally. Like my videos, like my live streaming even, and subscribe my channel with other parents, share it with other parents, and subscribe my channel Dr. Sana MedTalk, and you will find a lot of videos regarding your topic. And here I am on live streaming. I am still available for a few more time, so you all are welcome to freely ask me questions regarding the um, topic. The topic is picky eater. I have shown this poster also. Might be you are reading top tips for picky eaters. Yes, there are few tips which I share here. Picky eaters, for picky eaters, number one, repeated exposure. Don't give up too soon. 10 to 15 minutes tries to accept new food. Small portion, no pressure. Touching or licking counts. And the key tip is you decide what to eat, what to serve, and you decide when to eat. Makes casual, but the child will decide how much to eat. Number two, stick to the routine. 3 meals and two healthy snacks. No milk or juice between meals. Hungry kids try new food. Number three, be a role model. Together, all the family eat together. That's really work. Eat the same food, no special kid meal. Kids copy you what you do. Want to worry? When to worry? Poor weight gain. Eat less than 5 to 6 food, or then you have to consult doctor near you. So if you are watching this poster which you are here, it really summarized. I make it summary and then I share it with you. This is the best summary. You keep it, you can take the picture of this one and you will read it properly and you will understand how much important picky eaters need to be fixed and how can we fix. I'm Dr. Sana, general practitioner, and you are welcome to my channel, Dr. Sana MedTalk. And join me in live streaming, and we are talking about the topic picky eater, picky eaters, and I share some tips and tricks with which you can fix the problem. Keep in your mind, parents, don't be angry on your kids. Don't be, aggressive. Don't, just be patient. This is the thing which we can uh, gain by patience.